Welcome to the Vibrantly You podcast. We're your hosts, Megan Martineau
and Caitlin Cipriano. In this podcast, we talk about fitness and nutrition on your motherhood journey. Whether you are trying to conceive, pregnant, postpartum, or beyond, you are welcome here.
Nothing is off limits, and our goal is to support you in this important season of life so that you can feel vibrantly you. As a reminder, this information is not medical advice. Please see the show notes for more details. Welcome back to the Vibrantly You podcast. Today, we are going to be talking about doulas and advocacy and birth because I am recently a birth doula, which is very exciting. So we are going to be talking about just like what is a doula, what kind of support do they offer, what do they not do, kind of go through scope of practice, and also just talk about advocacy and how having a doula as part of your birth team can just increase your confidence heading into labor and birth. This is also something that, the reason that I became a doula was also because I had a doula in my second birth. I talk all about that in 2 podcast episodes, and I will link those below. But I talk about my second birth experience in episode 27, my birth story. And then I also talk about 6 things I did to prepare for my VBAC in episode 33. So if you're interested in those episodes, you can head over to those and listen to those. But basically, after my own experience of being a client of a doula and having a doula support my birth, I was like, wow, this is amazing. And obviously, I have experience on the fitness and exercise side of things and supporting people throughout pregnancy with exercise and movement. And so doula work just really goes hand in hand with that. So decided to become a birth doula.
Which is really cool. I understand obviously what doulas do and how they can be really helpful, but I haven't had that personal experience from a receiving end. So I'm really excited to hear you talk more in depth about how it can be helpful and, what people want to look for if they're interested in hiring a doula.
Yes. So let's first talk about what a doula is, because I feel like sometimes there's confusion around this. Sometimes people think a doula is like a midwife and someone who is just less hospitalized, but it's still like delivering babies and things like that. And that is not what a doula is. A doula is a trained birth professional that provides education, guidance, and support to pregnant, laboring, and postpartum people. So a doula provides physical support, emotional support, advocacy, and education. So some fun facts, some research on doula support is that having a doula as part of your birth team has a 39% decrease in the risk of C-section, which is amazing. A 15% increase in the likelihood of spontaneous vaginal birth, also amazing. 10% decrease in the use of medications for pain. A 38% decrease in the baby's risk of a low 5-minute APGAR score. So that's the score that they, give a baby when they're born. 31% decrease in the risk of being dissatisfied with your birth experience, and then shorter labors by 41 minutes on average. So
Those are cool.
those are some cool stats on having a doula on your birth team.
Yeah. I think something that I think is great about having a doula is just that you do have this like built-in team member who is like specifically there to help advocate for you. As someone who had a traumatic birth experience, particularly in the like postpartum phase where you have to like really figure out like how to advocate for yourself on your sort of on your own. I mean, I had my husband to like help, but like essentially you have to like be willing to do that for yourself, and that's hard. So I think when you have someone again built into a team who is like designated to do that for you, whether you end up having a difficult experience or not, you at least know like this person is in my back pocket. They're specifically here for me and they like have experience in this and know how to handle it.
Yeah, I think something that people worry about is like obviously you have your labor and delivery nurse, and labor and delivery nurses are gifts from God. You know, if you believe in God, they are angels, right? They are so, so important to your birth team. But at the end of the day, they work for the hospital, right? So it's like, yes, they're going to help you 100%. But I think sometimes people are worried, do they have my best interests at heart all the time? Like, how much are hospital policies factoring into their decisions, whatever. So having a doula is an independent person, right? So you're not having to worry about them like answering to a higher up or anything like that. Like they are there specifically for you. And I think that gives people a lot of comfort. Doulas do not make any medical decisions, which I think is a very important thing to point out. Doulas do not tell you what you should or should not be doing. So I think that's another area of misconception where when people think of, oh, a doula is there to advocate for me, something to keep in mind is that, like, if I am your birth doula, I cannot be like, you know, oh, Caitlin doesn't want this. You know, I can't say that to the doctor. Oh, Caitlin doesn't want that right now. You still have to be the one that's saying things, right? Like, or your husband, if you're
Right.
like, or your support person, if you're like, I don't want to be the one to say it. We tend to try to like tell, dad or the spouse, be like, you can be the loud vocal one because they won't get mad at you. But you can, in a scenario is like if I know in your birth plan, because we have done prenatal visits, we have talked at length about what you want, things that you are comfortable with, what you are not comfortable with, and say you have decided I am declining cervical checks unless they are necessary while I'm in labor, right? I don't want people sticking their hands up me while I'm laboring unless it's absolutely necessary. So I know that that is on your birth plan. Say the doctor comes in, they're doing rounds. Oh, Caitlin, time for us to do a cervical check. I can come over to you and be like, hey, the doctor would like to do a cervical check. It is not medically necessary right now. You have in your birth plan that you didn't want cervical checks. Are you okay with them doing this? And you can say, if you're like, no, I'm not, then you speak up and you say, actually, I don't want a cervical check right now. Right. So it's kind of like I'm there for you to be like, hey, this is what was in your birth plan. Are you comfortable with this? Because sometimes the providers come in and they're not asking your permission, right? They're like, "Hey, I'm going to do this." They're not asking you. They're not obtaining consent from you. So it's my job to be like, "Are you okay with this?" So I'm kind of reminding you to speak up for yourself, essentially.
Which I think is so helpful when you're in the like thick of it because you're going so inward at times that like that might not even be like on your radar. You're just like literally trying to get through the next contraction, you know?
Yeah.
So,
Well, and
and
I've
your husband or partner might not be thinking about those kinds of things either.
right, because a lot of times they're like, "Oh my gosh, you're in so much pain right now." Like, so much is go like they're worried about you and how you're
Yes.
coping, and they're not always thinking about, "Wait, that's not what we wanted," you know? And also, like, the role of the doula can kind of help slow things down and pause. Again, as long as it's not an emergency, obviously, in an emergency situation, the providers need to do what they need to do. But the role of the doula can kind of slow things down, like, hey, Caitlin has some questions about what you're talking about. Can we explain that a little more so she understands what it is that you're wanting to do? And just try to like slow things down a little bit, give the patient time to absorb the information and make their decision. But I do think an important part of doula work is all that like prenatal prep work. So like when you are still sound of mind, you are not in labor, like weeks before your due date, we're sitting down and we are talking through what it is that you want, what your birth preferences are. You're getting all of the evidence-based education so that you can make informed decisions ahead of time. So then that way you're not having to make those decisions in the moment. Like you decided on those ahead of time. The doula is there to gently remind you of what you wanted, but also you can change your mind in the moment. that's totally fine. But just like having someone there to remind you of like, hey, this is what you wanted. Is that still what you want, or do you want to change your mind? So, like, for example, for me, I wanted to have an unmedicated birth with my daughter. I labored unmedicated for as long as I could. And in my birth plan, it said, like, do not ask me for an epidural. Like, I did not want the staff saying, hey, you want an epidural? Because I was like, if I'm not sound of mind in the moment and I'm in pain, I'm going to be like, yes, give me the epidural. Like, I wanted to come to that conclusion on my own without somebody influencing me
Right.
outward, right? And so then I did get to a point in my labor where I turned to my doula, Jenna, and I was like, I need the epidural. And she was like, are you sure? She just reminded me of the things that I had previously said that I wanted. She was like, it's your decision. You're allowed to change your mind, but are you sure? And I was like, yes, I'm sure. And she was like, all right, let's do it. So like she was still very supportive, but just wanted to make sure, like, is this the decision that you want? Are you going to be okay with this moving forward? And so I think that's really helpful too, the role of the doula to be like, again, kind of slow down, like, let's just take a beat. Are you sure this is what you want? And I think that's why it increases the satisfaction of the birth experience because you do have that third party there to slow things down for you, make sure things are explained to you at a level that you understand, and also just supports you in each decision that you make so that you don't feel like you're pressured or forced into things.
I think that makes total sense, like that correlation with that evidence-based statistic. I also really liked what you said about just all of the like education that you do like prior to the like laboring experience because I think that it can be like missed for a lot of people. You only have so much time with your provider. If my brain is remembering correctly, I think in both of my pregnancies, like it was maybe like one meeting where you were really like specifically talking about what your like birth sort of preferences are. And so you don't even know if that's the like provider that's going to be be there for a
Right,
birth.
yeah.
And even though they have it documented, again, being able to have someone that knows what you want inside and out and is going to pretty much be there regardless once the time actually comes is huge.
Yeah, exactly. And it's like we talked about before, even your spouse, husband, whoever is with you, even if they know all your stuff too, like they're very emotional in that moment, just like you are, because they're watching you labor. This is probably something, if you're a first time mom that they've never seen before. They've never seen you acting like this, in this much pain. And so they're worried. And it's like at the end of the day, they just want to make sure you're okay. And so they're probably not thinking about your birth plan and your preferences because they're also overwhelmed. Because birth is overwhelming, especially if you don't really know what to expect. So, yeah, I mean, that education piece is so key ahead of time. I know for the doula agency that I am working with, our protocols is like we have education classes that people are required, well, not required, I guess. They don't have to, strongly encouraged to take the education classes
Yeah.
in their pregnancy, hopefully before third trimester, ideally. And then we have prenatal visits. So we have one prenatal where we're going over the birth plan and preferences and getting that all down in writing. And then the second prenatal is an in-person visit where we are going through counter pressure and different like laboring techniques, things for you to do in early labor when you're still at home. Like, when is it time to call your doula? Like, when do you want us to meet you in birth? Um, so really laying that groundwork when you're still pregnant is super important too. And so I feel like most doulas do this from what I understand. Like there's a whole prenatal aspect and then the actual, birth support. Because I know sometimes people just think about the actual like labor and birth support, but there's a lot of groundwork that's laid beforehand as well, just to make sure that you fully know what you're going into. Because knowledge is power and understanding the process and what to expect, again, helps with that birth satisfaction too.
Absolutely. Yeah. I think again, it's great to have that third party person for all of those different scenarios again, both before, during, and after as well.
Yeah. So just some brief things of like what doulas do versus what they don't do. Some just like scope of practice. Doulas do provide one-on-one support, personal attention, relational equity, providing continuous care, comfort measures, biomechanics of the pelvis, teaching that, advocacy support, education information. Things that doulas do not do: take the place of medical professionals. That part is very important. Perform any sort of clinical tasks, give any sort of medical advice, diagnosis, treat anything. Doulas do not judge, condemn, or coerce. They do not replace the birth partner, and they do not deliver the baby unless, it's an emergency situation and no one else is there. But that is not the, general scope of
Yeah.
practice. Because again, I think people sometimes confuse a doula with an actual medical professional, and that is not what they are. They are there for
Yeah.
physical support, emotional support, education, and advocacy.
So, I mean, so things that are so helpful and needed more of in the current state of like maternal health care, especially
Yeah.
in the United States.
Yeah, so in terms of like the physical support stuff, this is going to be like position changes when you're in labor, especially if there's like some stalls trying to get you moving. Doulas also do understand the biomechanics of the pelvis. So knowing which positions are going to help you based on what stage of labor you're in. They can help with massage or counter pressure, things to help reduce some of the pain and discomfort that you're in.
Counter
Um,
pressure is the best. Just
yes.
ask for counter pressure.
Dude, I still even like some of the counter pressure now because my friend Mariah, who I teach a prenatal movement class with, I had her help me just record a video for a client because I was trying to teach one of my fitness clients counter pressure. So her
Mm,
husband knew how to do it. So Mariah was squeezing my hips, doing the hip squeeze just for
yeah.
video. And I was like, wow, that feels really good even when I'm not pregnant. I need someone to squeeze my hips regularly.
Yeah. This feel
Um,
really good.
yeah. And even for the physical support, is doulas help with that early breastfeeding too. If you choose to breastfeed, helping with that early latch postpartum and assisting with that. And then emotional support is going to be different coping methods with pain and discomfort, encouragement when you're in labor, because there's periods where you're like, I can't do this anymore. So that encouragement,
Yeah.
empowering you, affirming you, affirmations, um, helping with trauma support too. Like doulas are not, again, medical professionals, which also includes mental health professionals. But when they are there for your birth, they can help you process what happened because they were there, they observed the birth, so they can help you process that if you do have some trauma surrounding your birth. And then obviously advocacy, like we already talked about.
Yeah, and I was gonna say even like you're there at like can help be their advocate, so you can also help like be a part of like a referral
Hmm.
network, right? Like if they are struggling with like PPD or PPA or something in their postpartum experience, like you can be there to like recommend people that are within your network that can also help them and just, having someone that knows who to appropriately refer to is huge because they already trust you,
Yeah, and I know like our doula agency, we have specific mental health providers that we partner with and refer people out to that we know are great providers. So that's huge. And even like PT referrals. So like we're, well known in the community, well connected. And I feel like most doula agencies are. They know the other adjacent professionals and have those referrals, right there.
which is huge because if you're going through that experience, the last, thing that you need to be trying to do is Google or send out a Facebook post in a mom's group looking for a therapist for a therapist recommendation,
Yeah. And then the one thing I forgot to mention too is like most doulas are on call from the time you hire them. So even if you hire them in your first trimester, right? Like they are there for you. You can text them most of them. I at least that's how I know it works for our agency and other doulas that I'm familiar with. But you, have access to them to ask them questions. So you're not having to wait until your next appointment. If you're like, is this normal? Like, or, oh, my, SI joint hurts. Like, what do you recommend I do for that? Like, you just have another like trusted person on your team that you can ask questions. And this extends into postpartum too, because most birth doulas will continue support at least a couple weeks postpartum until you're settled. Some doulas even do both birth and postpartum, and typically they will then just transition into your postpartum doula. But even if they're just a birth doula, usually that support extends, like 1 to 2 weeks postpartum, which I think is fantastic because I've worked with so
Yeah.
many postpartum women just on the fitness side of things. And usually they have to wait until they're 6 weeks postpartum to get any sort of answers from their providers, right? At that 6 week postpartum appointment. So having a doula is so helpful, to be like, should I be feeling this much pressure, in my pelvic floor? Like, is my bleeding appropriate? Like, you have someone to ask questions, and then they can be like, oh, that sounds like a lot of bleeding. I would recommend you call your provider. Again, rather than going into a mom group on Facebook and being like, I'm bleeding a lot at 3 days postpartum. Is this normal? And people are like, yeah, I don't know. Like, no, you're
Which is so
dying.
common though.
Yeah.
Like I see that stuff all the time. I did like go out of one because it was just so like stuff like that. And it's just so, I mean, it's so sad
Hmm.
too, right? Because it just means that moms are not being supported in the way that they need to be supported in this period of time.
Right. Or you're like on Reddit, like going down rabbit holes on Reddit threads. And it's like instead, you skip the Googling, you have a trusted person that you can ask questions. And if they don't know the answer, they will connect you with someone who does, right? Or say, call your provider. I think
Yeah.
sometimes too, a lot of moms in pregnancy feel like they're overreacting and they don't want to be calling their OB every, every time they have a slight concern. And so it can be nice to have that kind of not a middleman, but you know what I mean? Like someone who's not calling the provider, but someone to be like, hey, you know, I'm having a lot of discharge, what do you think? And they can be like,
Yeah.
oh, well, ask you clarifying questions and then be like, yeah, I think you should call your provider, or nope, that sounds pretty normal. And then,
Yeah.
you feel better about calling your provider if your doula is like, yeah, I think you should call. Then you're like, okay, I'm
Yeah.
not overreacting. I'll go ahead and do that. Sometimes people
Yes.
need that little bit of that little nudge, to be like, it's okay to call
Totally.
your provider. This is appropriate.
Yeah, and again, you just save yourself a lot of like doom spiraling into things by again having someone that you trust that's also specifically trained in these kinds of things.
Yeah. And then the last thing I'll say before we wrap this up is that if you are considering hiring a doula, I do highly recommend that you interview several people or agencies. Definitely, shop around, talk to different people, and see what the best fit is for you because it is a very intimate experience. You want to feel very supported and aligned with whomever is going to be supporting you through this. So I definitely recommend reaching out to different people and interviewing and so that you find the person that's the right fit.
Absolutely. Absolutely. I agree. Well, thank you, Megan, today for sharing just like some great outlining information. I think hopefully this will help people better understand what doulas do and if this is something that they want to look into for their pregnancies. If anyone has questions for Megan, you can find her on Instagram over at Vibrant Mama Wellness. And we hope you will share this episode with a friend. We will see you back next week.